sure you've all heard of epilepsy before. It affects 2.3% of the world's population and has over 65 million victims worldwide. It's a neural disorder that impairs the victim's ability to live and lead a normal life through the occasional seizures that happens. However, did you know that epilepsy has a 23% misdiagnosis rate? That is crazy. That happens to be 90,000 people in England being misdiagnosed for epilepsy every single year. So if you went to a doctor and he told you that you had epilepsy, there's a 23% chance he's wrong. Like 77% accuracy does not work in today's society. And this has other consequences as well. The victim's friends and family have to deal with the pain and confusion, as well as the associated medical costs with the expensive treatment of epilepsy. And the patient has to pay for these costs, which could have been spent towards the actual treatment of the actual ailment they have. So how do we deal with this? How do we fix this diagnosis? We have to dig deeper into how we actually diagnose epilepsy. So, to do this, we actually use a technology called brain-computer interfaces, non-invasive ones to be exact. When a patient figures out that he's having seizures, he goes to a doctor, a specialist in neurology, and that specialist will tell him to put on a device containing electrodes placed strategically around the head to pick up EEG brain signals. And that when the seizure happens, these electrodes can pick up the brainwaves, which are then sent to a computer to be analyzed. And if they test positive for epileptic signals, it's confirmed that this person has epilepsy. However, there's a major caveat. What is this? It's noise. These electrodes around the head pick up EEG brain signals, except the problem is that it can pick up a bunch of other external noise as well, being eye movements, blinking, muscle movements, and even temperature and electrical fluctuations. And when this noise is mixed in with the EEG brainwaves, it can make it very inaccurate and can often tip the scales in believing that the patient has epilepsy when they actually don't. So this, along with doctors often over-relying or not relying on this EEG brainwave data at all, often accompanies that the epilepsy will be misdiagnosed. And often, doctors rely too much on the patient's history as well. So if the patient has a history of epilepsy, be it from their parents or family, the doctors will be often quick to determine that the patient has epilepsy, even when they might not. And the seizures are a result of other problems, such as injuries, heart conditions, other brain disorders, and anxiety or depression. So I decided to look deeper into the topic of noise, and I found that the way we actually denoise EEG brainwaves right now is with a process called ICA, or Independent Component Analysis, which is basically a statistical modeling method coupled with linear algebra, which can separate a signal into its separate components. So, for example, say we had an EEG brainwave. It's composed of the EEG brainwaves along with a bunch of different nodes. So when we perform ICA on it, we can separate this EEG brainwave into its eye artifacts, muscle artifacts, temperature and electrical fluctuations, and most importantly, the EEG brainwaves. And when we piece all of the components of the EEG brainwaves together, we can hopefully get a clean signal. However, the problem is that ICA is a bit of a complex and very tedious process, which many doctors are afraid to undertake. And it also has a ton of shortcomings as well, and a bunch of different caveats in between that can make ICA very inaccurate overall. So I was thinking, since I've been going pretty deep into AI and deep learning for the past several months, and I want to see if I could apply this because ML and AI is often used for denoising other types of data as well, including images and audio signals. So if we're able to use deep learning to map a distribution from noisy brainwaves to clean brainwaves, specifically using one-dimensional convolutional neural networks, we should be able to have a distribution and a model that can perform this. And I've also been working with two very special people, Sohail Borhani, a BCI researcher at the University of Tennessee, who taught me a ton about BCIs, how they work, the noise associated with them, and also encouraged me to look deeper into this topic. And also Abhi Rampal, the CEO of Solid State AI, who is an expert in the terms of noise. He studied it for over a decade and taught me a ton about this, and also encouraged me to look deeper into deep learning solutions as well. So besides denoising EEG brainwaves, what else can it do? So I've also been looking into brain-to-speech BCIs lately. So how we can help ALS and locked-in syndrome patients communicate with their friends and family, because these patients are often paralyzed. They can't walk, move, or even talk. So providing a means of communication would be very beneficial. However, since they can't talk, they obviously can't communicate. So recently, development in BCI has allowed these patients to look at a keyboard, a visual keyboard, that emits light at different frequencies. And using a BCI headset, we're able to determine which letter they're looking at and string together text and figure out what they're saying. So this has provided an accurate form of communication. The problem with this is that due to a ton of noise in the environment, it's very slow. It can only communicate at 12 words a minute, which is not viable for today's form of communication. So if we're able to denoise these brainwave signals effectively, we should be able to provide a more effective, accurate, and fast means of communication. And of course, providing an accurate diagnosis for the millions of people in need and preventing misdiagnosis. And that's my vision for EEG-based BCIs. Thank you.